Hello there, I'm Bernie from Respiratory Therapy in the West Coast General Hospital. There's two therapists on in the West Coast General Hospital, myself and my colleague Caitlin, and we work 7 days a week, 7 till 18:12. So please give us a call. Our numbers are up in all the departments, plus our local if we happen to be in the office. Today I want to talk to you about the Airvo and how to use it from the beginning to the end, where we're going to be doing cleaning and storage. First of all, when you have a patient who needs to have an Airvo, you're going to come across something like this. When it's cleaned, it will be bagged and tagged so that we can maintain a degree of infection prevention control, and everybody knows that this now has been cleaned. Bring it down to the patient's room and continue to get it ready for the patient. These devices do not have a battery backup and will not need to be stored plugged in when they're in the storage room. First off, plug the device in and add your oxygen extension tubing to the low flow oxygen meter. Airvo, unlike the OptiFlow, runs off of a low flow meter of oxygen rather than a high flow device, which is behind this, if we were to take the flow meter off. Once you've got it all plugged in, just make sure you have all the necessary parts. When it's bagged and tagged, you should have all the necessary parts that are needed to set this patient up. You have an unopened bag of inhalation fluid, a setup that is clean and ready for a hookup of one of the sizes of the nasal cannula. Okay? Currently, we are using down our stock of symmetric nasal prongs, and we'll be moving into something called the Duet, which is asymmetric nasal prongs. I will talk about those a little bit later and add on some information packages about the difference and why we're switching to that. In fact, the whole company is switching to that. So if you have all of those three, then you're ready to go. On your Airvo device, there are hang tags. Some of them will be replaced because I have some new ones from the Fisher & Paykel representative teaching more about the asymmetric nasal prongs and other things that are new to the device. You have a nursing reference Airvo 2 card. And on these, you will find everything you need to know, everything that we're talking about. There's a step-by-step instruction on these swing tag cards so that you would know how to clean it, disinfect it, put it back together, help with sizing of the nasal prongs, and operate it. On each of the devices, there should also be, which may apply to some departments more than others, more like emergent with the pediatric nasal prongs or neonate nasal prongs, how to fit them and the ones that we have for them. And then the nursing device just sort of talks more about how it looks and what it should see on the front screen, as well as the reasons why you would go with an Airvo device when you're using high flow oxygen. Disclaimer here that I need to add from Janie is that the Airvo is not under regulation for the licensed nurses, LPNs, to touch or change. So this is more for the RNs who can manage everything. LPNs, when I was sitting in the optimization of the LPN scope of practice, we could not add this in to that practice at this time. Therefore, I want you to know about the device and how it operates so that if something is not working right, you can take it to your RN so they can make interventional changes. So to turn this on, we are going to hit the power button. Power button is the big brown button right at the top. You hold it down for a few seconds. It will come on. And at the beginning, you will see it swirl around in a circle, a little circle. First it tells you it has last been disinfected. And it's green, so green means go, you can take this. If you see a yellow or a red, that means somebody's put it away and it hasn't been cleaned properly. You should put this aside and grab another one to use. So there's your little swirly circle in white. What it is doing is just getting ready for use. While you're doing that, you can spike your bag so that we don't burn the bottom of the humidifier, because that will cause problems with the function of it. And that is a self-filling feature, so you don't have to push air in it or push water in it at all. Next, you can go to the patient and look at trying to size them. No best way to do this, you're going to look at their nares and try and figure out what is the best size to use without fully encompassing the whole nair. So you want to have a little bit of space around. Once you can figure that out, let's see if we can find a picture here. Here's the best picture I can show you on this card. You want to have not it fully encompassed so that you cannot get any air around, but that you have a little bit of space around the nares. Just a little bit, not too much, because then that would be the wrong device again. So fit is key. Once you're able to figure out what the nair size is, you open up the device, and I'm going to open up two for you today. I'm going to open up the asymmetric and the symmetric in the medium sizes. So if you have one of our symmetric sizes, you will have a device that looks like this. And at this point in time, you've probably fit your person to this size. These are flexible silicone type based prongs. You're going to want to put them in, and I always say to put them in first while your device is still warming up. So once you've got it in, make sure it's tight around the back of the head, high at the back of the head, so it doesn't slip down. And then once you've got it ready, let's just do this on myself here. So I'm going to put this prong in, and then again fit it so that it's up on the top of the head. Just tighten it a little bit, not too tight that they actually feel pressure under their upper lip, because you can get skin breakdown right under here. So just a little tight so it stays up. Once you've got that all in and ready, hook them up and they will get the therapy right away. Okay, this here is a little clip, and I want you to clip it right here so it doesn't constantly pull down on the patient. As you can see, there is a tiny little clip that hooks this piece to the strap. That needs to be there, otherwise it just sort of drags the patient down. So once you have it like this, then you're able to have your patient move around. Because this comes off of this side, if I was in the bed, I would want my Airvo set up on this side rather than it coming across the body over here if I was in bed. So always keep in mind where your prong is coming off, and rather than going across the body and patients then complaining that maybe it's too warm, go on the same side and have it come down there. The package also comes with a second clip. Just put that second clip there because you may want to attach it somewhere on the bed so it's a little bit safe. Right now, as you can hear me breathing, there's a lot of flow, and this flow helps to provide a dynamic pressure to help stabilize the airways open. Right now it's running at 60. If you have a patient coming in respiratory distress, severely or moderately, you may want to start at 60. The starting points would be between 40 and 60 liters of total airflow. At this point in time, there is no oxygen teed in. This is just airflow coming into the machine and helping to create that positive airway pressure. So the theory is, if I'm set at 60, I would then gain a positive airway pressure of 6 centimeters of water pressure, all things being optimal. That would be with my mouth closed so that I would get all of that 6 into my lungs, opening the airways up. But because this is a flow-driven device, as soon as you open your mouth, all the air, some of the air comes out, and you cannot guarantee that that patient is getting the optimal 6 centimeters of water pressure of dynamic airway pressure. That is the difference between a device that delivers CPAP or PEEP or BiPAP and an EPAP. They're pressure driven, they have masks on. The idea is that's sealed and they will then get the PEEP or CPAP or EPAP that they need. Here it's more dynamic because your mouth is always opening up and you have relief of some of that pressure. So if I was severely distressed, I would start, or requiring a lot of oxygen, I would start at a higher air flow rate. And then I would follow it with oxygen, add in some oxygen so that I maintain my saturation order, either 88 to 92 or greater than 92 or greater than 90 to 94, whatever the doctor chooses. I'm going to show you how to turn this down. So all of your devices get operated in this little thing here. Right now it's just in a steady state saying everything is done. Once you hit the play button, you will see that you have a temperature, a total flow rate, and the oxygen. The oxygen coming through right now, because I haven't added any oxygen in, is indeed 21%. So all I'm getting is airway support right now. If I wanted to change any of these functions, I would press the up and down button together for about 3 to 5 seconds. But of course, I would have to be in one of these. So right now, this is locked in at 37 degrees, and 37 degrees is body temperature. And the ideal flow and temperature to completely humidify the gases that are going in so quickly. So press these both down if this is what I want to change. After about 3 to 5 seconds, it will flash. And here you can see a choice between 31 and 37. So I want to drop it down. I can drop it down to 34 mid-range or 31 if they complain of too much heat. You can either press it in or just wait, and it will lock after a few seconds, as you see. So now you can't change it until you go in and press those 2 buttons again. Then I move along to the air flow that's coming in at 60 liters. Again, I'm going to press the 2 buttons, up and down buttons down, and I'm going to unlock it. And I have a choice anywhere between 10 and 60. But for people who are in respiratory distress, you would start between 40 and 60. So you can, oops, there you go. If you don't touch it, it locks up again. So I'm going to take it down. They go in 5 steps to 50 to 40. And again, I can lock it in, or I can just wait and it will lock in. So as you bring down the flow, you can hear that you're getting less positive airway pressure and your oxygen will change. And this is a great, for instance, to show you here. I'm going to add in oxygen. So here's the last setting you get. You cannot change your oxygen here. This is just basically telling you that your alarms are set between 21 and 95. If you go higher than 95, you will get an alarm. So here we go. We're going to add in some oxygen by turning on the flow meter. Doesn't matter what you are set at, doesn't matter at all. What you want to do is meet the patient's saturation order. So right now, it doesn't matter what's here, I want to know what it's analyzing at. If I was to turn this up, I would get more. And you have to wait a few seconds for it to equalize. And once it equalizes, those would be your settings. So my settings right now are warming up to, I think it was 34% that we had. Oh no, 31. So it's still warming up to 31, which is fine. I have 40 liters of airflow because we turned ourselves down. And right now I have 39% oxygen. Again, when I'm changing the oxygen, it doesn't matter what's up here. It matters, and you should chart what is here. This is the official analyzed oxygen that is being added into that 40 liters of flow to give you an FiO2. And you want to record an FiO2 rather than what's on here, because it really doesn't make any difference what's on here. It's here that makes the difference. Now, to show you something that would happen, I have less flow coming through, and right now I'm at 59%. Say somebody came along and said, okay, well, I think he still has a lot of work breathing, or my patient still has a lot of work breathing. What you need to do is increase the airflow to see if you can stabilize that work of breathing. So you go to the total flow, which is airflow coming in, press down your two buttons, and change it up. So say I said, okay, 55, whatever, I'm just choosing something. Lock it in. What happens to the oxygen when you increase the airflow? When you increase the airflow, there's more air coming in for the amount of oxygen that was there. So your oxygen FiO2 drops down. Same is true if I was to go the other way. With the higher flow rates, I'm now set at 55 total liters, which is air, and I've added in with the flow meter 71% oxygen. That are my settings, that's what you chart. Say now, the same is true when you drop down. So say I want to drop my airflow, my patient isn't comfortable, so then I drop it to 40. Lock it in. Well, now look what happens to my oxygen. Because I have less airflow coming in, my oxygen, analyzed oxygen, is going to go up. If your patient doesn't need that much oxygen, then turn it down. And you would turn it down by changing the flow meter. And as you turn this down, you will get your reading to keep your saturation order current. Whether it's 88 to 92, or greater than 90, or greater than 92, whatever you need to follow. So just remember, if you add flow, this oxygen that I have set right now at 40, I'll show you again. As I bring it up, I'm adding in more airflow, and the oxygen will decrease. Doesn't necessarily mean you need to add more oxygen, because now you've got more dynamic airway pressure helping to stabilize and keep the alveoli open. So those two, that's how those two work. Okay, if I was to want to go down, again, press in the two buttons together to unlock it and drop it down. So hopefully everybody has a good understanding of how the oxygen changes with more or less airflow coming in. This device cannot go to CT or or X-ray. It doesn't have a battery backup. You cannot use it. My suggestion is if they need to go to CT, X-ray, or an appointment, then put them on a non-rebreathing device, an oxy mask, or an oximizer nasal cannula, which has a reservoir for oxygen. And when they come back, then put them on again. Just to show you too, the full extent of the analyzer in here, if I was to put it so that I needed lots of oxygen, you'll see once it gets to 100, which it can't do, it's going to start beeping at you and it will show an error. There you go, O2 too high. If you have somebody that is there accidentally, well then dial it down. If you have somebody that requires that much oxygen, it's a CCOT call, it's a doctor call. You need to do a different intervention, and that's a different talk. So just to demonstrate that point. If your bag is empty and the heat is rising up too high, which I can't show on this, it will tell you that you need to replace the bag. Do not let the device run dry. It will burn the bottom of the humidifier, and that's plastic in there. The float system is plastic. So I'm going to put that down so we've shown that. So if you go to CT, X-ray, or anywhere else, call your RTs. Let's figure out what's the best device for them to go for that little trip. As you turn it down and it settles down, it will automatically turn off. Okay? All right, now we're going to go through the cleaning of the Airvo. Your patient no longer needs it, and it's time to clean. And this also is on the swing tags here, showing you the steps. First, you want to do a surface clean after you take everything off and throw it out, because the whole thing is a disposable unit, and we're going to get the new supplies. We take everything off, we surface clean, and then we're going to do the high temperature disinfection, which takes 55 minutes and is timed by the machine. So your patient's done. We're going to turn this thing off by pressing the big on-off button. It ultimately will turn you off. If you still have oxygen teed in and you haven't taken the oxygen off yet, it will ring and say, take the oxygen off ultimately. So I'm going to take the oxygen off and turn off the flow meter. Everything you see here that you used with the patient interface, is garbage. The extension, the bag, the humidifier. Make sure you don't touch the bottom because it's a hot plate. Slide it out carefully. Disconnect your water bag and drain it. This can go in the garbage. So once you've stripped off your machine, you can leave it plugged in. Well, you're going to be taking it down to the storage room, so you'll unplug it, take it all to the storage room, the clean storage room, and we're going to just surface clean it. When we surface clean, please make sure you get all parts for IP and C practice. Make sure your swing tags are cleaned off in between patients as well. And just let them dry. Try and hang them so that they, once you've got this part cleaned, you can let them air dry so that they don't stick together. And then just carry on down, including the basket inside and out. And then the machine, all the top functions all around. We do not have the little popsicle sticks to go through these things. Just use your cabbie wipe, put it in and out. This part is going to be going through a high disinfection anyways. Your cords all the way up and down. The back of the machine, which houses also an air filter, which occasionally will come up in the front screen saying it needs to be changed if it's that time. Otherwise, don't worry about that. It will always come up in the screen. And then below and on the legs of the machine. Okay, once it's dry, then you can start the disinfection process. But before we do that, let's plan what we need in order to put this back together while we're waiting for that to dry. In your storage room, your clean storage room, you will find a Airvo kit. It has the humidifier pot, the connection for the humidifier pot to go to the Airvo, and the new hose. You will need a new set. Make sure you have all the sizes, a large, a small, and a medium, ready for use in the basket. You will need a 7-foot oxygen hose and a new bag of inhalation fluid. Okay. The only other things you will need is a bag once it's finished and it's all set up to go over for IP&C reasons. And just to let your colleagues know, put a green tag around it so everybody knows that it's been cleaned and set up appropriately. Everything is there. So when they grab it, there is good knowledge that this is all ready to go. Nothing is missing. We are going to hook on the little high disinfection hose. There's only one way to put it on, and you can see here in this screen, this swing tag here, it shows you how to put it on. The top is self-explanatory. It's the same connection. You just pop it on the top and on. And there's only one way to put this hose on. You cannot get the cork in there. It has to go in the open port and this one right here. Once you've got that on and it's plugged in your storage room now, because it's clean, press on the power button. The power button will come on. And ultimately what you'll see now is a red spinning circle to get itself ready and prepared. And once it's ready and prepared, it will come up with a clock that says 55 minutes. It will beep and come up with a clock that says 55 minutes. So while you're waiting for it to clean, you can put your new supply in here, just one of each. You don't want to put too many going into patient rooms, especially with IP&C tags going up and having minimal equipment in the room. We don't need a lot of everything in there. All you need is one set of everything. You can put this in here, and your bag. You can actually get it ready and just hang it so it's ready to go when you have that patient and time is of the essence. You can see that the red swirling circle, it is still working. It's still preparing itself to be ready. So it does take some time. So there you go. It's now come up and it started at 55 minutes and it's now counting down. At any point in time, you'll come by and you'll feel like, oh, this is hot. Not to worry, this is a high temperature disinfection, so it will be warm. That's how it's disinfecting itself. So we're just going to leave this to be until the 00 minutes is down. Just to remember too, your air is going in here. So when you're adding in total flow, that blue button, it's pulling in air at that particular rate that you set it. The oxygen, if you're going to put oxygen in, is coming in here and mixing in with the airflow rate. Okay, so they still get 60 liters total flow, but now it's diluted with the oxygen that's been put in. And that's how you get your FiO2. Once everything is done and we're ready to take this off, I'm just going to go through this. We'll pretend that this is all done. You would add in your 7-foot extension tube and just leave it in a bag ready for use so we can keep it as clean as possible. You would open up your kit, which comes with 3 pieces. It comes with a new hose. It comes with a humidifier pot, which you're going to pull these out and just let this over top. And it's going to come with the connector piece between the machine and the humidifier. So let's just say this is clean and we're ready to take it off. It will read 00. We're going to turn everything off. We are going to disconnect everything. Put this back in the clean room where they have it stored. There's 2 of them in there. And we're going to start putting things together for somebody else to use. It's only one way for the top to go on. It clicks in. Put your top piece there. And your humidifier, now that you've got the connectors fit on. And there's only one way to fit it on. Your line has to face out. Do not face it in to the machine like that. It needs to face out like this. This is the appropriate way for it to go in. Press down on the lever so that you can slide your pot in. And last but not least, make sure you really get it in and you hear that click so that all the pieces are connected properly. An important thing to note is when you're setting up the Airvo again for use after you've cleaned it, when you hang the bag, do not spike it. The bag is only to be spiked with the spike to the humidifier when the patient is using it. We shouldn't spike the bag and have it ready in the humidifier because that is open water and a breeding ground for bacteria. Once you have that done and everything's dry and ready to go, bag it to keep it clean. Tag it so your people know that you've got it all done and they're ready to go. They can be confident that everything is here. And pull the plug out. We don't need to keep it. There is no battery. So it can be stored in your clean room now, like this. I have a few other little pieces to add into this Inservice, but they will come in the form of little smaller videos just talking about the effectiveness of the asymmetric and the difference between the symmetric and asymmetric nasal cannula, the reason for them changing, as well as how to insert an Airgen, which will allow for continuous bronchodilators going through to the patient without having to take them off this device and put them on something else to receive the bronchodilators. This allows it to be a continuous system and into the patient. Again, disclaimer, LPNs, I'm sorry, you cannot utilize this machine, but I do want you to know how this machine works so that if you have to report something to your RN, you will know what is going on, how to read the machine. And also the bag, replacing the bag before it runs dry, very, very important. I would always put a new bag there every shift just so that there's the memory of I do need to check on the bag and change it when it's running dry. What else? Anybody can clean it, but in the wards, Dallas is one that checks to make sure these are always clean. But anybody can do it, healthcare aides, LPNs, RNs, or Dallas. You just want to be ready for your patient. We have 6 in the hospital, 2 that are kept in the ward's clean room, and 4 that are kept in the ICU for emergent ICU purposes. They all have names. Today I have Sneezy. Thank you, Sneezy. And I will try and add in any other little tidbits of wisdom to this Inservice for a fuller, broader knowledge. If I have forgotten anything, please come to my colleague, Caitlin, or myself, and we can answer any questions that you may have.